People are worried about getting prescription medications, and our friends from the Green River District Health Department have a program called Community Access Project. Is that correct?
Yes.
Thank you, ladies, for being here.
Thank you.
So I was asking because I thought this was a brand spanking new project. Not so.
No, not so. It's more than 20 years old. That we have 6 projects across the 7 county district health departments, and so we've been around for a long time, but we're here today because a lot of people are going without their medications because of food insecurity and other threats, and so we really want people to know that there are solutions to their problems.
So with the food insecurity, it's either eat or get your medication. Is that the situation that we're in?
It is, and people are going like halving their insulin or going without picking up their medicines, and you know, we know that people end up in the emergency room when that happens with pretty poor health outcomes.
Well, the prescription is there for a reason,
right?
For the way you take it. So LaToya, talk to us about where the medications come from and what prescriptions are available.
So the way it works, first your doctor write a prescription for you, then we do all the footwork, like all the paperwork, and we send it over to the different pharmaceutical companies. And it's over 5,500 medications that's available, from diabetes medication, medication for COPD, asthma, blood clotting, and just to name a couple. Ozempic is a big medication.
Of course, yes.
Rybelsus, Novolog, Lantus, Entresto. So yeah, we have access to over 5,500 different medications, and it's great. I mean, people need these medications, and we have a big supply demand for these medications.
And is this an ongoing project? It was not a window like from December to January, so this is ongoing?
It is, and so we take applications at any time. Often, though, you get approved for the whole year when you get approved, and so then we have to do a new application every January or at the beginning of every year. And so it's not too late to go ahead and get help at any time.
Well, it's, you know, just such a big issue, a mega issue, especially in this day and time. So when people come to apply, how quickly are they then, you know, if all the chips fall in the right place, how quickly are they able to access that medicine?
So what I tell my people when they come to apply, I'll be like, listen, make sure that you give me everything that I ask, from documentation, meaning they have to show proof of income. I have to see their insurance card. So as long as they do their part, it's anywhere from, sometimes within a day, I can get people approved for medication.
Really?
Yes. So say if you was in my program and I already had most of your information, you got a new medicine. Let's say I need help with Farxiga. Okay, cool. I get with your doctor. I send the medication, the prescription over to your doctor. Most doctors, they reply within a day or two because they know the need is great.
Right, sure.
So they fax the paperwork back over, and I'm going to fax it the same day, and within 2 or 3 days, I might have you approved for your medication. Now, you have to wait for it to be shipped, like 10 or 15 days. But if you don't do your part, then I have to wait, and it can be anywhere from 4 to 6 weeks because you didn't do your part. So I express to anybody that comes to see me, look, it's important. I'm going to tell you the documents that I need before you even fill out this paperwork, because I want you to get your medicine, yes.
Right.
Yeah.
And are those documents accessible on your website, so if they have questions, they can look and see a list of items they need to bring?
They can look on the pharmaceutical websites and see a list of items that they need to bring. But again, like, we express that through telephone call. We express that when we send out paperwork, we put a slip in all the documents that we need. But I try to, again, tell them ahead of time so they can work on it. So say, like, again, if you was in my program and you call me and say, LaToya, I need help with such and such medication, Ozempic, I'm going to tell you, hey, I need you to have A, B, C, and D.
Right. So
when you get my paperwork and you hurry up and send it back, I can do my part and make sure you get approved. Yeah.
I mean, it's kind of a win-win for everybody, is it not? And do they come there to the district to pick up the medicine, or does it come to them?
Well, it's both. Some pharmaceutical companies will deliver it at the homes, while others will send it to us, and they will pick it up from us. And so it varies from program to program. There, as LaToya said, there are 5,500 different requirements and different ways of doing things, but for the most part, I would say half go to the home and half come in. Angie, one of the things I want to make sure that I let the audience know is sometimes people don't understand how big the problem is.
Yes.
With every chronic diagnosis, people can spend up to 35% of their household income for their medicines.
Right.
And so if you could see if there's insecurities in any way, Murphy's Law comes to visit and your hot water tank goes out.
Right, and it does. It happens.
Yes, anything can happen, and you're spending 35% of your household income on medications, then something has to give, and often medications are it. And so it really breaks my heart to see people's health decline as a result of going out without their medication when there are solutions.
Yeah, and this is a great solution. Women, thank you so much
Thank
for the
you.
work you're doing, and thank you for getting the word out here that people have a solution.
Yes.
Thank you.
We'll be back with Ron's weather right after this.